So, my name is Alvin Musioma. I serve as the Executive Director at the Tax Justice Network Africa. And today we met here working with the National Taxpayers Association to launch a report, a study report that was done looking at the role that tax plays in tobacco taxation more generally, in terms of how do we ensure that we are putting in place mechanisms that can, more effective mechanisms of the taxation of tobacco products. That's really what the study is about, and the study provides a number of recommendations in terms of what we feel the government should do to ensure that the taxation regimes that govern the tobacco industry are more effective. And also geared towards, for example, areas around health financing. How do we raise money to invest in healthcare financing? How do we ensure that we are putting in place policies that discourage smoking? But also, thirdly, how do we ensure that the revenues that are being generated from the tobacco are being invested towards a universal health coverage? Of course, I mean, every year the government provides a budget in terms of where they're getting the money from and where that money is going. And that's the mechanism through the budget tracking process that we use to track overall government decisions, both on tax collection, but also on budget decisions. So, for example, if there are policies that are introduced that indicate that this is the amount of the tax increases that we are making on tobacco, but also the overall revenues, how these revenues are being distributed or allocated across the different sectors, including health, education, infrastructure, and other areas. What this report does, it actually recommends, for example, that beyond just general allocation, we should work towards ring fencing, because that's the only way we can be able to see the connection between the revenues that are the taxes that are raised from tobacco, and how that money goes directly to support healthcare needs of the country. So that ring fencing of excise tax from tobacco is one of the key recommendations from this report. Well, that's a tricky question, because I mean, studies show that the increase in excise tax on tobacco does not necessarily lead to a drastic reduction of tobacco consumption. But what we believe is that still a high level of tax on tobacco can act as a deterrent, particularly for new smokers. So it might not be the tool to stop the current smokers, but it can be a deterrent to stop people that are considering getting into smoking, but also for people particularly in the low income categories. Of course, they have to make economic decisions. The shilling that I have, do I buy food or do I smoke? And so the more expensive cigarettes are, the more discouraging it can be for decisions, particularly for the lower income earners to get into smoking. So the percentage question is not really the point. Is how do you actually use tax to ensure that you are discouraging new smokers, but also particularly what this also study confirms is that the people that are harmed most are the lower income earners. And of course, the third point, and this was raised by the colleague from the Kenya Revenue Authority, is that the question of smuggling is also a very important one. The figure that was given of about 21% of the total consumption of cigarette in this country is a result of smuggling. So it means that the measures that have been put in place to tackle that particular vice are not effective, and this is another area that needs to be looked at. That's a very interesting question. I think there have been regulations that have been put in place to curb smuggling of tobacco, either through customs and border control, through closer collaboration between countries, because when tobacco is being smuggled, of course, it's being moving from one country to the other. It crosses the border. So the collaboration, for example, at the the regional level is very important. I think what we should also to be able to avoid when you connect smuggling to taxation is to avoid this false analogy that if you make tobacco expensive, people will resort to smuggling. I think the two questions can be tackled separately. You can tackle smuggling of tobacco separately, but still at the same time increase the excise on the formal products, on the legitimate product, because ultimately what you want to achieve is not just the point of discouraging smoking, but also you want to ensure that you are raising revenue to invest in the healthcare industry. This project, we as Taxes Network Africa are supporting a number of countries. We are working in Nigeria, in Zambia, in DRC and in Kenya, and these are a cross-regional program that we are supporting different national level partners in those countries. And what we are seeing is that there are a number of lessons that can be borrowed from other countries. There are lessons that Kenya can learn from Nigeria in terms of what steps that they have taken to curb both the illicit trade on tobacco, but also tobacco consumption more generally. But also the study, like what was done here by the National Taxpayers Association, provides lessons that are very, very critical and important for other countries to be able to follow. And not just the countries in the project, but also even our neighboring countries, Uganda and Tanzania. I think we are winning. Definitely, I think that we are winning. Number one, from a purely revenue perspective, we are winning because although we have seen over the last couple of 2 years, I think there's been a decrease in the level of excise tax collected, and the Revenue Authority alludes this to the COVID pandemic. We don't know how much COVID contributed to discouraging smoking. That's a debatable question. But I think that from a revenue perspective alone, the amount of revenue that is being generated from excise tax is a very important aspect. This report did they did a comparison in terms of what would a slight increase in excise tax contribute to, and what it says is just as a 1% increase can contribute to about 4 billion shillings to the fiscal. So in that particular case, from a revenue perspective, I think we are winning. Secondly, in the region, of course, Kenya, although we have not achieved the WHO targets, we still, I think, in terms of tobacco consumption, Kenya is faring favorably well, and we feel that taxation of the tobacco products is one of the contributing, not the only one. Of course, we have to look at other things beyond taxation. We have to look at how the labeling question is done. How do you label tobacco products? How do you avoid, for example, advertisement in spaces that are young people frequent, in schools or near schools or other places. So, and even in Kenya, in terms of banning smoking in public spaces. So there are a number of steps that the government can take that go beyond just the tax. Tax is one tool, but there are other steps, additional steps that the government can take to try and discourage generally the consumption of tobacco products. It can never be enough. I think this is a starting point, and it's a journey. As you saw in the room, this was quite a collective of groups, and what the beauty of this study is it brings together different actors. We had groups that are advocating for health financing in the room. We had groups that are pushing for the tax justice agenda in the room. We had groups that are working, for example, specifically on tobacco control, and bringing these groups together to have a conversation by service a major achievement. This is a journey. What was agreed is that there's more serious engagement with other oversight bodies, including Parliament, working more with the media and other partners is part of the long-term, medium and long-term advocacy strategy that organizations such as the National Taxpayers Association and the Taxpayers Network are involved in going forward. That's an interesting question, but you see, the question here is that generally we would want to discourage smoking more generally, both for the rich and the poor. But when you look at the elasticity of tax, the tax instrument is more elastic in terms of the poor or the lower income earners. That means in their particular case, they will feel the harm more and stop smoking. And also, even if it was just for the poor, what you also must consider is that the people in the lower income categories also, because we don't have a universal health coverage, sicknesses that emanate out of cigarette smoking harm the poor most, because they don't have access to as effective healthcare support as the rich do. So either way, it's a win-win situation in my sense. But as I said earlier, it is not just tax. Tax might discourage the poor from smoking, but there are other mechanisms that the government can use to discourage smoking more generally. And that's a very good question. I think that, and that's really the most important thing, decision that can be made out of this, that the money that is collected from tobacco is not just to discourage smoking, but also to be invested in programs that support those that are trying to quit. And as you know, for example, the NHIF has programs that you can be able to, if you have any addiction, not just in cigarette, but also in tobacco, you can be able to, if you subscribe to a therapy center, the NHIF can cover some of those costs, but it can't do it nationally because costs of therapy are very expensive. They are very high for you to do a 3 months therapy on whatever tobacco or alcohol. Therefore, it really re-emphasizes on the need to ensure that there is more money that is being given so that government can expand those kind of therapy programs across the country.